Hello, I'm Major General Glenn Curtis, Adjutant General for Louisiana. I'd like to share with you my thoughts on how we can prevent suicides in Louisiana National Guard. September is Suicide Prevention Month, and it weighs heavy on my mind. Last year we lost 4 Guardsmen to suicide, and so far this year we've lost another 8. I am convinced that if we live up to our motto, protect what matters, we can prevent the suicide of any more of our Guardsmen, their family members, or your battle buddies. I need you to pay close attention to the following messages. One is from Chief Warrant Officer 4 Myron Turner and his wife Annette concerning their son Jordan, who committed suicide in July of 2010. Jordan was one of our fellow Guardsmen. And also a message from Mr. Steve McClendon, who is the Louisiana National Guard psychologist. The Turners and Steve have guidance and experiences that can save your life, your family member's life, or your battle buddy's life.
He really was a fantastic young man. He was very fun-loving, a little bit mischievous sometimes, but always in a good way. He was just always available to be around for us. He went with his sister on her first deployment, primarily because he wanted to be there to be a support to her. During his first deployment, he had planned to go out on a convoy and instead of another guy and just take this guy's place and give him a break. And the guy came in, I think 30 minutes before they were supposed to brief out and said, man, Tuttle, I think I'm just going to go on in this time. I'm going to go on out on this convoy. Well, that guy went out and got killed that night. He confided in me about that and his sister as well, who was over there with him, and it just really shook him up. When he returned from that deployment, he seemed to be doing really well, but within 3 months, I saw that he was really struggling and encouraged him to get help. And he just continued to isolate and withdraw. And of course, all of our lives were busy and, the disconnect happened. He was under the care of the VA, and they had diagnosed him with post-traumatic stress disorder based on the criteria that they give for that. When the time started coming for the second deployment, and because he had done so well the first time, he just really said, I think I need to go back over there. I really just did well over there. I enjoy that environment. I had a purpose, and I want to do it again. And then when Mr. Turner, that's what he calls Myron, is Mr. Turner. When Mr. Turner started talking about going, he said, yeah, I want to go again too. So
we had been at a particular location for about 4 months, working opposite shifts. Jordan worked at night. We had made a move to a different location, and shortly after the move, I think we'd only been there one night, and I received a notification from the chaplain in the dining facility about what happened and about Jordan taking his own life. And an initial reaction was shock and just being stunned.
I can say with all honesty, was the absolute worst day of my life. And I will never forget. There's just no description that you could possibly come up with that would explain the hurt.
I think what makes it particularly difficult for the National Guard service members are that they come back, they have the welcome home, they have the hugs, the kisses, all of that, the honeymoon period. But then they're going to go off to the 4 corners of Louisiana in our case. And in those 4 corners of Louisiana, they may be the only person in that community that's gone downrange. They may be the only person in that community that's actually in the National Guard. But whether or not they've been downrange per se, is not a factor when it comes to suicide. All that is like a risk factor. Risk factors for suicide can include a mental illness, such as depression. It can include substance abuse, most assuredly. We know through our research that about 50% of all suicides, alcohol was involved, or another substance. Another risk factor is loss of a job, loss of a relationship, feeling some shame, doubt, guilt about either what you've done or what you haven't done.
And, in the military environment, especially among, those kinds of environments where we're supposed to be strong and mission focused and all that, we're all supposed to have our squared away, mindset. I think we tend to overlook emotions. And actually, I think, the camaraderie, the connection that's there, that needs to be there, is actually should be intensified.
The signs are real hard to see for me. They have been. In fact, in this situation, I didn't see. I would say reach out, connect, talk to them, include, edify, uplift, encourage.
And it's so important that when you're going through grief, that you get help. You must get help. You cannot grieve alone. That is the worst thing you can do. And grief can happen through life circumstances. I believe a lot of the post-traumatic stress is grief, loss, and you need to seek out help and not be isolated.
That's exactly right.
If you have a battle buddy, you have a loved one, talk to them about what they're feeling. You asking them, do you feel suicidal? Do you feel like harming yourself or someone else? Is not going to drive them to suicide. That is a myth. That is not going to do it. The problem very often is that we don't want to know what the answer is. We really don't want to hear that answer. So then we avoid the question. And it's the very question we should be asking.
If you believe that someone's struggling, even if you don't know that they're struggling with those kinds of questions, certainly if you know they're struggling at all, I would rather risk offending somebody than to wish I had said something.
If a service member knows someone that is struggling, I would highly encourage them to reach out to us, reach out to the professionals, and we will get you the help that you need. We're not here to pass judgment. We're not here to make a soldier feel as though they've done something wrong by any means. That's certainly not the case. We are here to help soldiers. Air National Guard, Army National Guard, doesn't matter to me. I look at that one, it's the uniform. Several times when service members will call and they will express thoughts or feelings about death or suicide, they will not readily admit, okay, this is how I'm coping. I don't want to go to mental health. I don't want to reach out. I'm afraid it's going to hurt my career. This is not going to hurt your career. This very well may save your career. Reaching out for help is not something that is detrimental to a person's career. The problem that I see is when a person has a problem and they do nothing about it. Depression, very treatable. Anxiety, very treatable. Bipolar, treatable. Feelings of suicide, although right now, today, it may not seem like it when I tell you this will pass.
And optimism, a hope, a future are things that make life worth living instead of the alternative.
We need to get serious about protect what matters. If you need help, if your battle buddy needs help, or if a family member needs help, you need to let the Louisiana National Guard assist you with these matters. We believe in you.